Hello, welcome to Health Talk. I'm Dr. Manny. Multiple sclerosis is a tricky disease for both doctors and patients. It is difficult diagnosing it because the symptoms can vary widely and patients find it hard to describe. Joining us today to talk about his experience as both a doctor and an MS patient is Dr. Vincent Macaluso. He's a neurologist and author of Multiple Sclerosis from Both Sides of the Desk. Thank you for joining us. Why is MS so hard to diagnose?
It's hard to diagnose because its symptoms are so varied they can mimic many other diseases, and we don't have any test that proves that a person has MS. We have to rule out all the other diseases that could mimic it before we say that it is MS.
Well, and then when you allude to common symptoms, are there mostly neurological symptoms like headaches or muscle weakness, or is it symptoms of, cold and flu type of thing? That's what I'm trying to get at.
It's symptoms of things like strange feelings like burning over your back, or your feet are on fire, or your left arm is tingling, and some weakness, some visual changes, trouble with seeing out of an eye, but it's not blurriness, it's something else, and a overall feeling that something's not right and you don't feel like you're thinking the way you used to, which a lot of people write off as not being anything.
Now, you being a doctor and neurologist, what symptoms did you have?
I had my symptoms come on when I was in college, which I didn't realize were MS symptoms at the time, but as it turns out, I had a total change in my behavior, and I also had trouble studying after the disease started in me, and I felt like my mind wasn't working the way it had previously. The one that led me to Diagnosis was when I was studying for my neuroanatomy final. And somebody told me that if you look up and to the left, you can remember better. So when I looked up and to the left and tried to remember the cranial nerves, I saw two corners in the corner of my room. I said, that's not right. So I looked up to the right, there was only one corner, so I studied that way. But once I got done with the test and went home for the summer, I went and saw my ophthalmologist, who sent me to a neuro-ophthalmologist, who sent me for an MRI, and I was diagnosed.
Now, one of the things that you talk about on your own journey is that all these symptoms led you to, almost discoveries of being affected with brain swelling.
Mm-hmm. Yes.
And what is that like?
Well, since nerves work in a narrow temperature and pressure window, if you have a pressure too high or too low, nerves won't keep working the way they should. When you have MS, where your immune system is attacking the myelin that's in your brain, you have hundreds of millions of white blood cells jamming into your brain, and your brain is in a fixed volume, the skull, and when you put more stuff into a fixed volume, and the pressure goes up, and it causes a global dysfunction of nerves throughout the brain, not just the focal lesions people see on the white dots on MRIs. And by causing your head to be swollen, you feel like you're in a fog, and things aren't right. And it's so hard to say what it is because you don't know what it is that's changed.
Now, being a patient with MS and being a neurologist like you are, the doctor that treats MS, how does that help you?
Before you're diagnosed, I do the workup and I listen to what the patient says to me and tells me their complaints, and then of course whole history and physical and see what my findings are. But when a person with MS comes to see me, they start talking about the troubles they're having, and a lot of other doctors will hear it, and they're fine doctors, but they don't realize that when they say, I just can't get off the couch, I just can't move, many doctors call that the MS fatigue, but it's not fatigue. Right. Fatigue is muscle weakness. What they're describing, which I've discovered, is initiative. And we have our initiative stolen from us because of this brain swelling.
One of the other points that, again, being a doctor and a patient with MS is the hidden effects that MS has on people, and especially family members. Mm-hmm. Let's talk about that.
Family is crucial, and I love it when family members come in, because when we as MSers have our disease, we know what we feel like inside that nobody else can see. At the same time, there are things that we're doing that we can't see that others can. Mm-hmm. That is the bridge that I'm trying to create to help each of us understand. We as MSers, we have to understand that people around us are putting up with us, even though they don't know why we're acting the way we're acting. But the people around us accept us because they love us. But hopefully in the book, I can show that here's why we're acting the way we're acting.
Right.
Because of the swollen brain.
Let's get a little bit into what are the current treatments, or at least what kind of things are in the future when it comes to the treatment of MS.
Well, the biggest one that we have out right now, which has made the most inroad and has led to my discoveries that I have in this book, is a drug called Tysabri, which prevents the white blood cells from getting out of the bloodstream and getting into the brain. And once you do that, the brain shrinks. And the neuroradiologists who were reviewing MRIs of patients about 3 months after patients started on Tysabri saw that brains were shrinking. They said, that's weird. It's like the brain's atrophying, but that doesn't happen in 3 months.
Right.
So they named it pseudo-atrophy. And then they put it to the side, but that was it. That was the lesion. That was the swollen brain that paralyzes us. That's why right now, still Tysabri is the most effective one we have to slow down our disease.
So there's hope and there's medication and of course there's research going on. And of course there is this book, which you have to get because it explains a lot, not only to yourself, but also to family members, especially when MS is involved. Yeah. Where can people get more information?
MSfrombothsides.com.
Well, thank you so much for being here. Very inspiring and very educational. Right. I hope everybody buys it and gets it and reads it. Thank you so much. And if you have any health questions, send them here at Fox at drmanny@foxnews.com. Until next time, I'm Dr. Manny.